Welcome again in Understanding Basic ECG. In this lecture, we will collect all the foundations and information we learned about the ECG waves, and how to calculate heart rate, regularity, and all things all together to put them in a schematic presentation to know how can we read the ECG and how can we make good comment on it. This is a 10-step approach. To read the ECG, it is divided into 4 phases. Phase 1, look at the setup of the ECG. Look at the calibration. Look at the strip speed. And then start looking at the rhythm. Is the ECG showing regular rhythm or irregular? Determine the cardiac axis. Calculate the heart rate. And then go to look at the wave morphology. Assess the P wave. Look at the QRS characteristics and assess the T wave. And finally, look at the intervals and segments. So look at the PR interval, ST segment, and the QT interval. If you cover all the points, you will be able to make good comment on the ECG and to pick any normality. If we look quickly at things we learned about the ECG, it is a repetition of the PQRST complex in different leads. The ECG is formed of 12 leads. We have the P wave, which represents atrial depolarization, PR interval, atrial depolarization plus conduction in the AV node and AV bundle. The PR interval is 3 to 5 small squares, QRS complex 2 to 3 small squares, ST interval is normally isoelectric, T wave is normally positive. Occasionally, you may see the U wave, which represents the final part of the ventricular repolarization. RR interval, it is represents the distance between following cycles, and it is important to determine the regularity of the heart rate, because if the RR interval is of equidistance between each cycle, this means that the heart is regular. At the same time, we use it in calculation of heart rate. We have also the QT interval, which is from the start of the Q wave to the end of the T wave. And usually we use the corrected Q2 interval because the QT could be affected by the heart rate. The speed of the ECG strip is 25 millimeter per second, and the amplitude 1 millivolt gives deflection of 10 millimeters, which 2 big squares. Look first at calibration and strip speed. 1 millivolt gives deflection of 10 millimeter, which is 2 big squares, which is a normal calibration. If it is adjusted wrongly to half millivolt or 2 millivolt, half millivolt will give deflection only for 5 millimeter. This will give waves of low amplitude, and 2 millivolt will give high amplitude waves, which would not be correct. Strip speed is 25 millimeter per second, and as we know, this makes the duration of the small square 0.04 second and the big square 0.2 second. Second step, determine the regularity of the ECG. And to determine the irregularity of the ECG, ask yourself, are the RR intervals are equidistant apart? Means that they are equal. When you look at the distance between each two R waves, they are equal. Second question, ask yourself, is this rhythm occasionally irregular? Sometimes you can find the ECG following regular pattern, but irregularity happens at certain parts. This irregularity is regular or irregular. What do I mean by this? It means that do you have abnormal beat happening in a repetitive manner, for example, every 5 cycles, every 6 cycles? This means that we call it regular irregularity. But sometimes you find it following no pattern. And in this case, this is called irregular irregularity. 3. Determine cardiac axis. Look at the QRS complex in lead 1 and the QRS complex in AVF. Here you find positive QRS complex in lead 1, positive QRS complex in lead AVF, which means normal cardiac axis. Step 4. Calculate the heart rate. In a previous video, we discussed this in detail. We have three methods. We have the 10-second rule, which is good for irregular rhythm. So you count the number of R waves in 6-second strip and multiply by 10. Or divide 300 over the number of large boxes between RR waves. Or if you will use the small boxes, you know, every big box has 5 small boxes. So you divide 1500 by the number of small boxes. So here, for example, we use this method. So 1500 over the number of small boxes between the RR, which are 16. So the heart rate here is 94 beats per minute. Then we'll go to phase 3, step 5, assessing the P waves. We'll assess the waveforms and the characters. So we'll start with the first wave, which is the P wave. Ask yourself the following questions. Are P waves present? Yes, you can see P waves present. Do the P waves look alike? Yes, they are looking alike. Yes. Oh, could they be dissimilar to each other? Yes. If some of the waves are formed in the SA node, other waves originating from ectopic focus in the atria or from the AV node, the shape of the P waves would be dissimilar. Do the P waves occur at a regular rate? Yes, we can see this at a regular rate. And very important, is there one P wave before each QRS complex? Yes, there is one before each QRS complex because this is the normal that the formed wave in the SA node will spread along the atria, going to AV node, AV bundle, and to stimulate the ventricle. So you should have one P wave before each QRS wave. So the comment at the end would be normal P wave with one P wave for every QRS. And then step 6, assess the QRS duration. The QRS duration, as we know, it is between 1 to 3 small squares, which is 0.04 to 0.12 seconds. This is important because in certain ECGs, you will find wide QRS complex, which is more than 3 small boxes, so 3 small squares. Here in this ECG, it is 2 small boxes, so it is 0.08 and it is normal. Then step 7, assessing the T wave. As you can see, the T wave is smooth, asymmetric, dome-shaped, and it is usually positive, upright in the majority of leads. It is normally inverted in lead EVR, as we mentioned previously, and sometimes has variable morphology in lead V1 and lead 3. So the interpretation here, this is normal T wave. And the next step is to go to the last phase, phase 4, which is assessment of the intervals and segments. So determine the PR interval. The PR interval, it is 3 to 5 small boxes, 0.12 to 0.2 seconds. Here in this case, it is 5 small boxes, which is the upper limit of normal. You look in pathological cases at short PR interval or prolonged PR interval. Then check the ST segment, and the ST segment is a segment which starts from the end of the QRS complex at a point, we call it the J point, to the beginning of the T wave. It is normally isoelectric, and you assess this isoelectricity by looking at the PR segment here. If it is at the same level, so it is isoelectric. Usually, its deviation from normality in the limb leads should be less than 1 millimeter deviation from this baseline. If it is more than 1 millimeter above, we call it raised ST. If lower, we call it depressed ST segment. Here, the ST segment in this ECG is normal isoelectric segment. Then, step 10, and the final one, determine the QT interval. QT interval starts from the start of the QRS complex to the end of the T wave. It represents ventricular depolarization and repolarization together, which all the ventricular action potential. Because it could be affected by the heart rate, if there is tachycardia or bradycardia, we use this formula to calculate the corrected QT interval. Normally, in males, it is equal or less than 440 milliseconds. In females, it is equal or less than 460 milliseconds. Prolonged QT interval can carry risk of dangerous arrhythmias. If we make final comment on the ECG, so the heart rate is 94 beats per minute, regular. P wave is normal. PR interval is normal, 0.2 seconds. QRS duration 0.8 seconds, which is normal. ST segment is normally isoelectric. T wave is normal, positive T waves. QT, corrected QT is normal as well, and the cardiac axis is normal. So the final diagnosis, normal ECG showing normal sinus rhythm. By reaching this point, we have completed the videos of the normal ECG. And next time, we'll start talking about normal sinus rhythm, and from normal sinus rhythm, we will start to move to the pathology. So we'll speak next time about atrial arrhythmias, and then we'll continue the videos looking at different types of arrhythmias, and then myocardial ischemia, hypertrophy, and bundle branch blocks. See you next time.